Welcome to NoiseFilter. It's a pleasure to have everybody here, and our guest is here. So let's get our guest on board too as we get started. It is a
What's up, gentlemen?
all right, Gralen Banks, radio personality with WBOK. It's such a pleasure.
What's happening? It's my pleasure. It is. Thank you guys for having me, man. I really appreciate it. Thanks so much. That's on Columbus. He likes to get involved in the, whatever I'm doing. So.
Yeah, I could see Columbus is all in there, isn't he? Huh?
He's all in there. He may crawl behind me again, so don't mind him one bit, man.
Awesome.
So I'm looking for Gralen. You see him? I can't see Columbus or Gralen right now.
I'm here. I can see you. You
I
have
hear
a
you.
quizzical look. You're wearing a quizzical look and green scrubs.
Yeah,
I see the reflected in your glasses.
Can you see me?
I see you, Dr.
Do you see me waving in Eric's?
Yeah, that makes me every time takes me out. I can only take so much dairy at one time. You make me lactose intolerant.
That's terrible, man.
Well,
How's that? Can you see me now?
I can't yet, but MarkAlain can.
Yeah. Do you not see him on the? Is it a black panel?
It's black.
All right. So that's
I got to be black, bro.
You know what,
Hey, man? Listen, that's not a bad thing. That's not a bad thing at all.
I think, but Eric, I think this is the problem that we were having a couple days ago. So
Yeah.
we're gonna just have to kind of deal with it. If you're cool with it,
We're good. Let's roll.
okay.
Can you hear me at least?
Volume up.
Can
Volume.
you hear me?
Yeah. I mean, at least this is like us doing radio every day.
That's what I was just about to say. Because if you can hear me, then I'm good, man. If you can hear me, I know you might not be able to see me, but we can pretend we're on the radio.
That's exactly right. As we were saying, Gralen Banks is a radio personality with 1230 AM WBOK. Doc Griggs and I have a regular daily segment from 11:30 to roughly 20 minutes, 11:50. Sometimes, if we are on a roll, we'll try to be. We will push it right up to almost noon.
Right at that, you guys have taken that before, and you will do it again, I hope.
Gralen is without question one of the brightest people that I've met recently, especially when he has been wrapping his mind around something that he's probably never had to think about, terms that he's never considered, words that he's never heard before.
True, true.
And so it's been amazing to watch Doc Griggs and I come on his radio program regularly to see him kind of take in the information, and really kind of what comes out of his mouth is so well thought out. And every time we hang up the phone, Griggs and I always get on and I'm like, God bless it. That guy.
He blesses me every day, Doc. That's why I'm in a position to be there, man. It's I don't know why, but I can take stuff that is complicated and talk to the cat on the corner, and it's a gift. It's got nothing to do with me. It's a gift. It's a blessing, and I recognize it. And I appreciate your saying so, because that is what you guys bring is the truth. And the truth is recognizable in a universal sense. It's just got to be in a way that is recognizable. You know what I'm saying? And that's what you give me the big picture, and I can talk to the cat standing out in front of the liquor store and make him get it.
And it's funny because, when I first met Eric, that's exactly, Doc Griggs does that from a medical perspective as well.
With public health in the demographic in the community that Doc works in, you have to reference Big Mama. You have to reference Grandma. You have to reference people who have reverence in that community in order to get your point across. And that is what's so beautiful about it. You hang out on the front porch, you honorary first cousin, man. You get it.
Well, I should.
Huckabucks notwithstanding.
That's right. Huckabucks notwithstanding. Especially when Gralen, your mom actually does listen.
Oh, she listens. Listen, the companion dolls in the Korean soccer stadium has put me on a different level with mom. It's put me on a different level. And you guys too, just so you know.
Thanks, Gralen.
Just so you know.
That's amazing. I want to see if this actually works. Let's see if I can come up with this on the fly. Now it was not. Oh yeah, look at this. This may work.
You got 3 smooth stones in the slingshot. Go ahead, brother. You are working your way up in the family. See, that's some front book. If anybody is reading that and is questioning its meaning, I would tell you to tune into the NutriGround on WBOK 12:30 a.m. What New Orleans is talking about every day around 11:30, and you will get a true taste of 3 smooth stones and a slingshot. Good move there, MarkAlain.
I was like, I wonder if I can do
this really quickly, and it worked.
Yes, sir. Yes, sir.
Oh, it worked well.
You have surpassed the Huckabuck controversy.
Oh, dude. I'm about to get him a whole tray, Gralen. He's about to get a whole tray with the quarter in the bottom.
There you go. You have earned it, my friend. You have earned it.
So Gralen, here's how we're gonna run the hour. Right now,
sure.
This is on multiple Facebook channels. We're on Twitch and we're on Facebook as well.
Okay.
We usually get folks that kind of chat with us directly. We're starting to get folks that are actually coming into the chat room. They're thanking us. They're saying hello to everybody right now. And we also really encourage people to write their questions in. The first about 10, 15 minutes of the show is me kind of presenting slides. Usually what we try to do in the past is that
every day. Every day.
I'm going to...
Consistency. Got to be consistent.
Every day? Every day. Every day.
Hold on. Do you like it, Eric? Have you learned from them? And have you?
No. I dig the slides.
Yeah. Slides is hip, man.
Look, like I really like the part where he started to take the whole screen over, so I don't have to look at him when he does it. It's awesome.
Listen, you can find a bright side to anything, Doc.
Love it.
All right. So this is going to take about 10 or 15 minutes or so.
Okay.
What we were experimenting with yesterday was like trying to split screen, and it's not going to work with 3 people. So I'm going to take over all of the screens.
Yep.
And we're going to kind of go from there. So I'll be able to see you guys from where I am, but you guys are going to see the screen. And for those of you that are watching on Facebook and Twitch and YouTube, we're going to just flip over now directly to the slideshow. So I'm just getting everything ready right now to make that happen. And just give me 1 second, and we will be starting our slide deck. Do you see that, Gralen? That's a handsome picture. It's what I like to call not skinny Griggs right there. Are you guys there? Oh, yes, right. You guys can't talk, huh? Oh, that's right. Yes, yeah. You guys are unable when we're in this mode. There's no communication. I'm so sorry. God bless. I forgot about that. So I'm gonna flip back and forth. So let's just go ahead and get started right here. And so as we are starting here, we're going to just go over some quick epidemiology here. You can see we have reached about 5.3 million cases worldwide, which is unbelievable. You can see here we had 3,400,000 deaths. Last night, look at that, we added 88, almost 89,000, clearly almost 90,000 cases, with almost 4,482 deaths. That's about 4 people who are dying per minute globally. Think about that. Wrap your heads around what this is. We're about 4 people who die per minute. At the end of this, Facebook Live, that's going to be 4 times 60 minutes. People who have died over the course of this hour. Looking globally, you can definitely see cases are going up. So I think we were questioning whether or not cases are going to be going up. We were wondering if this was a blip or not. No. There's no question. That trajectory is definitively going up now. And you can see yesterday was almost one of the highest days. It was the second highest day of all new cases since the pandemic started. So we are not going in the right direction. The WHO did state that 2/3 of these cases are coming from 4 countries. Those 4 countries are the US, they're coming from Russia, India, and Brazil are responsible for a majority of those cases. When you look at the mortality rates, Thankfully, I really do believe this mortality is going down, and I think that that is certainly very encouraging and feel very, very good about that. When you look at the U.S., you can see we're at about 1.6 million cases with approaching 98,000 deaths. We added almost 20,000 cases yesterday, which is incredible. It's about 15,000 cases we add overnight. The number of deaths more or less stable at about 1,117, and I can't believe I've just now said it's more or less stable. That I have now internalized and normalized. I've done exactly what it is that Doc Griggs says I shouldn't do, which is I've normalized it. But yes, I totally just normalized that, and I feel bad that I just did, because that works out to be about 1 death per minute. When you look at the military deaths, we talk about this every day. We are rapidly approaching World War I. These are the number of military people who have died over the course. These are, of course, military people. This has nothing to do with the opposing side and the deaths suffered on the opposing sides, as well as all of the innocent civilians who have died. But you can see we are rapidly approaching World War I levels. We've blown past Korean War, we've blown past Vietnam, and we are rapidly approaching World War I. When you look at our epi curve, I am hopeful that, I don't know if this is going to be an upturn or not. Come Monday, we'll have a couple more days. I feel like this may start swinging upwards. We're hearing about these hot spots that are happening in rural America. We're hearing about potential second waves that may be happening in the South. I hope this is not reflective of an upswing, but at this point, it's very, very hard to say. When you look at mortality, just like globally, it is definitely going down. Of course, there's nothing normal about that, but I think that we are getting better with probably identifying cases sooner, getting them into the hospitals sooner before anything untoward happens. This is our testing. You can see Iceland is, without question, far and away does the most testing or the highest amount of testing. Per capita, of course, you have a couple of outliers here, but I think that the first real population for us to consider is Iceland, with about 171,000 per million people. When you look at where the U.S. is, we're number 37. We are constantly in the lower 30s. Usually, I think yesterday we were 39, so we have moved up a little bit. We're about 41,635 tests per million. We're behind Germany and Switzerland in that respect. This is the COVID tracking project. This takes all the number of tests. So these are positives and negatives. And when you take this positive and divide it by this total, you get a number of like 12%. And where we want to be is under 5%. This still means that we're testing the pre-test probability is high. That means we're still testing people that have a pre-test probability of being positive. In other words, these are symptomatic people. We really need to be getting into more of the asymptomatic folks. Before we go into Louisiana, I'm going to kick back over to our esteemed guests here, and that's Gralen and of course Doc Griggs and myself on as well.
Hey, am I back? Can you hear me?
Yeah.
I see myself.
I can see Doc Griggs, but now I can't see MarkAlain.
Yeah, we'll figure that out. MarkAlain's on the producing side today. What I want to touch base on is something I really
still here, but there you are. Can you hear me now?
Yes.
Yeah. So what I want to touch on is something
Doc Griggs' lips moving, but I can't hear him.
Yeah, I think MarkAlain needs to unmute me.
No, I can hear you.
Gralen, can you hear me?
No, I think Gralen can't hear you. Gralen,
I couldn't. I could see you. I could see you talking, Doc Griggs, and I can hear and see you now, MarkAlain, now. But in the beginning, you were blank.
Right.
Doc, I could just see your lips moving, but I still don't have audio.
All right, let me try this again, and then let me see if I can get him back on. Eric, can you try talk?
Yes. Can you hear me?
Nope, I can't hear you. I can read your lips.
So Sydney says that she can hear everybody. So this is
okay.
So we'll figure it out.
I can't hear Doc, but
all right.
So MarkAlain, you call out. Let me go, and then I'll let you, because if she can hear me, what I'd like for you to do is talk about the mortality rate and the death rate, and talk about the relationship between the number of cases and actual number of deaths. Because it looks a little confusing. It looks like it's going up in one and like it's going down in another.
Right. Everybody here is saying they can hear you, Doc Griggs, and so Gralen, what Doc Griggs wanted me to do was kind of flip back and talk a little bit about the mortality rates that we've been seeing, and kind of highlight on those.
Mortality, and talk about the deaths, because remember we were talking about watering down the number. You do more testing, you get a higher number of cases. It makes the virulence.
Right.
It makes the virus look more lethal.
Right.
So we're testing only sick people, and they died.
What Doc Griggs was saying was that as we test more people, we're going to see more cases. We're going to start seeing declines in mortality rate, which is 100% correct. And I think that's a very, very good point.
And how that's different from frank death rate.
Eric, say that again, Gralen. I'm sorry.
No, I would say, Doc, you've been saying the whole time to concentrate on the mortality. Concentrate, because that is the true indicator, the number that is truly skewed when you look at the number of people who are actually succumbing to this disease.
But
that's right.
I want to make a distinction between deaths and mortality rate. The number of deaths is the number of deaths. The rates can be affected by the amount of testing.
Right. So what Doc Griggs is saying is that the difference between deaths and mortality rate, of course, the rate has a denominator. That's a fraction, right? And so, and usually at this point, Doc Griggs usually really focuses on that we can't normalize the mortality that we are seeing here, because you saw me just completely be like, whoa, these are the normal deaths that we get every day. And I'm like, oh my goodness, I can't believe I said something.
That is the part that you want to continue to cause shock.
That's exactly
that is the thing. Right. That is the thing that would get people's attention, and if you get their attention, you may be able to fire them up into being active or taking some action into doing something to save their own lives.
That's exactly right. I'm gonna take it back out to the slides real quickly, and let me see if we can get this fixed. If not, what I'll have you do, Eric, is I'll just have you. If it doesn't work when we come back, I'll just have you just cut out and then just dial back in. Okay. Yeah. So I'm gonna. Okay. All right, so let's try this again, and we will go to share screen, and there we go. So here's us in Louisiana. We had a huge uptick of cases. This was the so-called lost cases, I think, that they had been talking about. I'll show you that graph. Excuse me, this is why we see an increased number of cases here. We're coming up to about 37,000 cases with almost 2,700 deaths. You can see, fortunately, there have been no official new cases assigned to Orleans and Jefferson. I think that, I know that we haven't had any new deaths, but I know that we've had new cases. So I think that Worldometer just didn't update this slide in time by the time I created this deck. But I know that there's been no mortality, but you can see there's just no cases that have been assigned to parishes here at this point. But what I do want you guys to look at is that. That is that is definitely an outlier. And they had been talking about these cases that had been quote unquote lost, or these tests that had been lost. And so I'm not sure. I was waiting for this uptick to happen, and you can see even the graph makers even responded by putting a little uptick there. So I think that this is definitely not a trend. I think this is going to be an outlier, or kind of a one-off sort of thing like you see here or like you see here. Again, what we're seeing almost consistently is this downward mortality rate. These trends are trending downward, and I think that this is great when we're talking about straight mortality. When you're looking at the case rates, Louisiana is 1, 2, 3, 4, 5, 6, 7, 8, 9. We're still 9th at about almost 8,000 cases per million. But you're starting to see that we were, for a very, very long time, we were number 4 with New York, New Jersey, and Massachusetts, and then we were here. and that has definitely, a bunch of other states have come in. But what was unique about this was that these are 3 states in the Northeast, and we were the first state that was solid in the South. And this has largely to do with what we talk about pretty regularly, which is social determinants of health. We have a very high proportion of our community that are on the lower levels of the socioeconomic scale. We have the highest rates of poverty, some of the highest rates of homelessness, and of course, when we're looking specifically at communities of color, we have some very we are looking at communities of color that are disproportionately affected, and so it was with some sadness that we would see that we would be the only southern state up here, and it was very kind of in your face that we had these very high rates. But we have moved down, and I think this speaks largely to the rapidity by which the state and the city have really responded to COVID. The fact that we're doing a lot more testing, we're able to identify positives and get them isolated very quickly before they're able to virus to other people. When it comes to mortality, we still have very high rates of mortality. Again, we are number 1, 2, 3, 4, 5, 6th in the country with 574 deaths per million people. And again, this speaks to, again, we're seeing, at least these 4 states here are some of the early states that were colonized in the U.S. That made into states. So these are very high, densely populated states. We're the first state in the South that's listed here. And again, we're talking about disproportionate amount of people that are in communities of color that are affected, especially when it comes to mortality, especially having multiple chronic illnesses that are diseases of poverty. Our testing rates, we were at one point number 1 and 2. We've fallen, but I think we're still pretty good in the country. We rank about number 2, 4, 6 in the country with about 67,000 tests per million people. Our infection rate, this is a little bit of concern. This is the R0 for the state of Louisiana. You can see we're approaching 1. I think that this number, we've been hovering around 0.84, the same as the number as that hovers around the city, right? The city's R0 is about 0.84. So this is looking at what the reproductive rate is. I think this number reflects that big uptick that we got for the state. And I think that that's why we crossed over to 1. But essentially what this says is that one person living with COVID will give it to one other person. So that's what that reproductive number here is. You start getting into epidemic and pandemic levels when it's like you see here, the reproductive number was very high at one point, and the virus was all over the state. And you can see the same thing here for the city. Our R rate has been very, very low, and that means that we do have things under control. This is looking at Orleans Parish. We've been doing very good with, again, this little uptick that you see here reflects that uptick in cases. In terms of daily new deaths, it looks like, again, things are going down. And when you look at testing, I think we've been doing a good job of getting more tests that are being done. And so that's great news. And then I'm going to show you guys this in a moment from a different perspective. But looking at, we have plenty of ventilators, we have plenty of ICU beds, and we have plenty of hospital beds as well. So I think from that perspective, I think we've been doing very, very well. And I'm going to bring my guest back on board. Hopefully we've got everything here. Eric, do you want to see if Gralen can hear you?
Yeah, Gralen, can you hear me?
Yeah, there you go. I can hear you now, Doc.
Yes. So what I want to emphasize again from the slides real quick is that I want people, the mortality rate is based, like MarkAlain said, on, Dr. Dery said, on a numerator and a denominator, the deaths per million. Sometimes it's paired to the number of cases. That's a lot of math to think about. What I want you to pay attention to, the easiest math to pay attention to, is the number of new deaths per day, or the number of deaths going up. Did we have more people die today than we did yesterday? It's a real simple, go immediately to the deaths. It brings you into the frame of reference, and all that other stuff can make sense. It'll make sense as you go, as long as you see the number of deaths staying the same or going down. We know that if they're going down, we're doing something right. If that number's going up, we're doing something wrong, and we've done something wrong 2 weeks ago.
So because the numbers that you're looking at now are just catching up.
It's just right. The deaths follow the cases. So when we see people outside not wearing their masks, congregating, hugging at the bar, throwing parties this weekend, hanging out, no masks,
Right.
No social distancing. We know in 2 weeks, you're going to see the number of deaths in New Orleans, in Louisiana, and in the United States, and in the world start to go up. But it's localized, and that's what we talk about all the time, Gralen. There's a world view with the World Health Organization. There's a country view with the CDC. There's a state view, and there's a local community view. And if you look at New Orleans, the reason we were able to open up, like we talk about on your show, is because we did what we were supposed to 2 weeks ago.
Right.
Now, we messed up during Easter, not 2 weeks ago, before 2 weeks ago. We messed up during Easter. And you're going to see a consequence of that, and that's what we're starting to see with the uptick. And hopefully, we will we'll get it better than we've been doing this week, so we can stay that way. We can't. Again, the data brought us out, and we do data every day. MarkAlain, this is just the data y'all see us do. We do data every day. So just like the data led us out, it'll lead us right back in. Gralen?
Now, when you saw the down slide on that first slide, the last slide you showed, Doc, when it went from red to blue and it came down like a roller coaster, was that as a result of folks across the state listening or adhering to the stay-at-home, social distance? Because other than that, nothing's changed. The virus hadn't changed. There's no cure. There's no vaccine. The only thing that changed that number was people's behavior.
Absolutely.
Yeah.
I mean, I hope that we have now indoctrinated you into our public health practitioner club, just like I've been indoctrinated into the front porch.
Yeah.
Well, you're almost there. You make fun of them huckabucks one more time, dog. Gralen, I'm throwing them out the back door. We ain't even got a back door. Say it one more time. Say it one more time.
That is exactly right. That's why public. It doesn't take much. But it just takes getting through people's thick skulls. That is the most important thing.
Because it's showing those numbers, and you guys do data, and you have said that from the beginning. The only way that number went down, there is no other data other than the ones that show that people staying apart makes it go down, because there's nothing else you can factor in. There's no medicine, there's no testing, there's nothing that can even be said to have caused that number to go down, other than adhering to the rules that's been put in place.
So I want to say something to exactly that. We talk about a lot of negative stuff and we laugh and joke to try to make light of the situation. I really want to praise the people in our city, in our state, for doing so well, so long. We stayed when it was told to go in the house. We did the best we could. I mean, I literally, and I can honestly say this, MarkAlain knew about it. I had a moment, man, back when we were really spiking. We weren't supposed to gather. We were told we couldn't have a second line. We were told that we couldn't even have a funeral. And members, honored matriarchs and patriarchs of our community, started passing away. And I was driving down one of the major streets, and I literally had to pull over, and I had a moment and just broke down, because I saw people from the church dressed in their Sunday best in our community, standing as far away as they could with gloves on their hands and whatever mask they could, trying, knowing they weren't supposed to congregate.
Knowing they weren't supposed to.
But there was no way that they couldn't honor the people that they love. They weren't able to see them for the past week and 2 weeks. And I'm like, I just literally broke down, and I looked up, I'm like, but they're trying. They're trying. I mean, this hurts. I don't want it ever be normalized to accept the fact that the number of deaths, we only lost 2 people per minute per day. We lost 3. It's coming down. It's only 5. It's going to double at the end of the. That's not normal. We're still human beings. We're physically distant. We're socially connected. I don't even know your mom, Gralen. I don't know your parents, MarkAlain, but I love them to death. I mean, I just do. That's who we are.
Responsible, and I feel the same way, because they're responsible for both of you guys. That's why we never say. You never hear me say easy. I'm never going to tell you it's going to be easy. I'm telling you it's necessary.
Right.
It's castor oil. It's when you're a kid and your parents are giving you something that is horrible.
Yeah.
But they know that it's good for you in the long run.
That's right.
That's what this thing is. It's not forever. It just feels like it. But
it does. And it's a natural part. All the spikes and up and downs that we're talking about, Gralen, and that's why we need you continuing to soothe the soul of the public with everything that you're doing at WBOK and the way that the artful way that you're putting the words together to let people understand this hurts. It hurts all of us, but there will be an end to it. And this is a natural part. I always make reference to history. This is a natural part of the experiments of trying to reopen and be human. And then we're going to mess up and have to go back in the house, and some people are going to hurt, and we're not supposed to agree. But we're going to, what I love about us, particularly us here, we get smarter and we get more creative. It doesn't make it hurt any less, but we end up finding ways. We continue to do so.
And I just find a way, Doc.
That's exactly right.
You can't get away. You can't run and hide. So you find a way to make the best of it. It's not perfect by a long shot, but it beats the alternative. You know what I'm saying? Sitting around and crying and moping, and because guess what? That's not going to change anything either.
Nothing.
That's not going to, and all that's going to do is bring you down. So the more you can adapt, the more you can find a way out of no way to make nothing out of something, to make something out of nothing.
Now MarkAlain, he's in church right now. He's making a way out of no way, turning the darkness into day.
And look, I'm quoting them boys too. That's cash money. Find a way to make something out of nothing. You know?
You're a paper chaser. You got your block on fire right now.
Block on fire, baby. You know you gotta find a way, because your only choice is to stop, and we can't do that.
No,
can't bow down. No bow down. No whom bow. We can't bow down. Not on that dirty. That's not gonna happen. We gonna fight until the fighting is over, because that's County Cullen, man. If we must die with my back against the wall, fighting like a man, I got nothing left. But the one thing you're not gonna get from me is acquiescence.
And the thing is, we're gonna fight after it's over. You're gonna have to come get us. Hey man, stop it.
Back.
It's over. Hold on, man. I see COVID again. Is that COVID?
Ghostbusters ain't got nothing on us, baby.
MarkAlain, can you please explain again the concept of R naught?
I was gonna do that, because I think Gralen really nailed it, and I wanted to kind of go back to that slide right here, which essentially shows this was behavior right here, right there. That was behavior. Yes. So what we're seeing up here is, and I know it's hard to see, but go ahead
and make it big. You can take us out. Make it big.
Well, I want you guys to talk, because we're also starting to get some comments and stuff too. So I want to share with you those comments. But as you can see at this point here, this is one right here. So the R naught is the reproductive number. So when any virus gets to less than 1, and that's mostly through vaccines, that means that if it's less than 1, if it's 0.5. A virus can infect 0.5 of a person, or it's very difficult to do. Do you know what I'm saying? But if an R naught, or the reproductive number, is 3, that means one person infects 3 different people. Right? So like HIV has an R naught of like 3 or 4. One person has the potential of infecting 3 or 4 people. Measles has the highest of all R naughts. It has an R naught of 18.
Wow.
Think about that. That means one. That's why an unvaccinated kid walking into Disneyland who has measles, and then that's how you get all of those measles, because that R naught it's off this goes to 2.3. It's off the charts, right? So, but this is why. So what you were saying, Gralen, is 100% correct. You see, we fell here because of our behavior, and then stood here because of our behavior right here. And that's so important for us to acknowledge that and recognize that what it is that we are doing is working and has been incredibly helpful. But I want to just quickly just show you guys a couple more slides.
But MarkAlain, don't leave that slide just yet, because I want people to understand the reason that it fell. A virus doesn't spread the virus. People spread the virus. The reason it became less infective is because there were less people to infect.
That's right.
Nothing happened to the virus.
Nothing happened to the virus.
That's exactly right. That's it. So remember, viruses exploit human behavior, right? Yes. So herpes is all over the world because people have sex, because viruses exploit sex. But Hep C is all over the world because people inject drugs. And so it's going to exploit that behavior. Think of a virus, influenza, people cough and sneeze, and we don't do a good job protecting ourselves or whatever, and then it gets around. The same thing with COVID. It's far more infectious than influenza. It's one of the most infectious viruses that we've seen, and the reason why with people change their behavior, the virus has remained constant, but the R naught changes because we are changing our behavior, because the virus has to respond to what we're doing. If we don't do anything different, it's going to exploit it. If we change, there's nowhere for the virus to go, and that's why wearing masks are so important.
So as kids, to put it in terms, Gralen, I think we all understand that dog that bites everybody on that one street can't bite nobody if you stop going down the street.
You stop going down that street. He only bite the ones dumb enough to keep going in front of his house.
Don't go down that street. He ain't bite nobody.
What's that old joke? Doc, it hurts when I do this. He said, well, let's stop doing that.
Yeah, don't do that.
That's okay. How's that?
Listen, if you're tuned in, you are listening to a NoiseFilter. My name is Dr. Dery. That's Doc Griggs, and it's a real honor and a pleasure to have with us radio personality Gralen Banks, who is on 12:30 AM WBOK. Doc Griggs and I have a regular daily morning podcast, also called NoiseFilter. You can find that on all of the podcast platforms. Couple quick questions I just want to address. Okay. I want to get back to what we're talking about. So a good friend of mine, David, says, is the CDC in your opinion underplaying the spread of the virus via services? Dave, I actually have a slide for that, and I will get to that. I promise you I will get to that. But the answer is no. I actually believe that via surfaces, the virus is very, very low level of transmission, that the overwhelming is through the respiratory route. Miss Charlene asks, how important are carbon filters in masks? Eric, do you have a thought about that, or?
I don't. I think that's a novel idea. Did I say novel? It's a novel idea because I've not really heard that one. We know most about the N95s, the KN95s, and again, I used to have hair on my head. The virus, the average hair is 75 microns. The virus itself is 0.1 microns, and that's a science. That's something I'm very comfortable saying I don't know, but I can find out and look up.
Yeah, I think that it's just important to wear a barrier. The barrier is the most important thing, and more.
I saw there was I think the Chinese study I referenced it I think yesterday, where they showed something beats nothing. It would be great if everybody had an N95, and it would be great if everybody had the top of the line, but more so than getting the best, get something.
That's right.
Because it will stop any face covering. I think they said it'll stop about 80%. The best one will stop 90, 95%.
Right.
But nothing is just that. And if anything you can do to cover your face, from a bandana, like you pull up your T-shirt, if you don't happen to have one, cover your nose and your mouth with something instead of just raw dogging it and walking there and don't have nothing on your face.
MarkAlain, can you find that video? I think it would be perfect. A great way to go into Memorial Day too, if you could find the video.
I could if you guys talked for a minute, but it would be hard for me to do it.
Yeah.
I don't think either one of us have a problem talking to each other.
It would be hard for me because I have to do it through Chrome, and it's not on Chrome. It's on my desktop. So I would have to upload it somehow through Chrome.
We'll have time. I
will find it. Listen, I also want to say that Rasha reached out to you, Gralen, and she says love on one another from afar. So when you were talking about love and the importance of loving one another, she was responding, and then she also says that I love all y'all for what you do.
Thank you. Tucker, love you right back.
Tucker says, any proof to it entering the eye? So that's a really good question.
That's a great question.
It's hard to answer that question. There is a virologist who actually was coming from New York to New Orleans. This is a story that Dr. Hebert,
Dr. Hebert not only said that, he knows the doctor.
We talked about it on Coronavirus Corner.
Yeah, we did.
Yeah.
So we're aware of it, and we're finding out more, Doc. I saw a blip about it, and have tried to do some. I haven't seen any more. I haven't even seen non-peer-reviewed journals on it. So we're still finding out.
Yeah, we don't know at this point, but the idea essentially is that the receptors that the virus uses to get into the body are found
ACE2. ACE2, they have them in the eyes, the nasopharynx, in the lungs, in your GI tract, and in testicles of men. And those are the places where you're seeing the symptoms, believe it or not, which is why they had the hypertension, whether or not to take your high blood pressure drugs, which you should. Please keep taking your meds. Yeah.
Right. So let me just kind of quickly just jump back to this real quick. Let me just kind of show, as we always do, because I'm just stunned at these numbers every time I see them. What we're looking at here is just Brazil. It's just every day they're locking in a higher number than the day before.
Did you see the drone footage of the mass graves?
No.
Oh yeah, yeah.
Did you see that in Brazil? That's scary.
Yeah.
Now, and something else that comes to mind when you said that if we don't do what we need to do, that is a precursor for our fall season. You said that, and that's been ringing in my mind. I've mentioned it to a couple of people because of that's in a different hemisphere, and they're in fall right now. If we don't do what we are supposed to do right now, pay attention to the grown-ups in the room and the folks who have been doing this thing from a scientific background, then we are looking at what could possibly be our future this fall.
You know, and it's funny, you know, I'm thinking, and Eric, I've been meaning to kind of pitch this idea to you, we can talk about it later, is, you know, maybe starting a column or something about silver linings of COVID-19. But here's one of these silver linings, is that right now, the people who are taking care of the folks that are being affected by COVID-19 in the favelas, which are the slums in Brazil, right? Are the gangs. So the people who used to terrorize these individuals have completely shifted perspective and are now the ones that are instituting public health, common sense public health policies, which is really incredible. It's a really incredible story, and it's something that I've been following. It's something I will definitely kind of keep you guys up with as well, because I think it's really a very touching story.
So MarkAlain, you hit on something. You hit on one of the most scientific but undocumented, and you're not going to find it in a graph, but one of the essential components of any reaction or solution to this problem. And you see, I'm about to put my hand on my face. It's called common sense. Anime said common sense ain't common. If the virus ain't changed and it's outside and you think you can get sick, don't go outside. If you're worried about somebody breathing on you, then don't go around them. Cover your mouth. If you think you might have virus particles, or you sneeze, you get sick on your clothes, take them off. Common sense. This is common sense. Nothing about this virus has changed. I have no hair. If I don't like the sound or the feel of water on my head, don't go outside or put on a hat or use an umbrella. It's common sense. You know what? Maybe we need to start making a common sense meter. We can put that on an epicurve.
Depending on where you ran it, Doc, it would never move. In some places, the bar would never move. But on that note, too, Dr. Dery, during Katrina, I actually saw that. Young men.
Oh, right.
I'm a native New Orleanian. Some of these cats, I cross the street if I see them. You know what I'm saying? Because I know them. They nephews and cousins and everybody else, and I recognize them. But during the storm and when they started to evacuate the dome and when they started to bring all these folks from different parts of the city that were flooded through the dome, these were the young men who were standing up. Let the ladies through. Let the babies through. Say, bro, hold up, man. Say, man, that's my family. Say, come on, bro. Now, I'm looking at this little dude. Natural leader during the course of this event, right? But in his real life, he was a leader too, just for a different type of issue. But I can understand what's happening in the favelas because that's the same mindset. If nobody's going to be in charge, why not me? And if I can take care of my people, then that's what I'm going to do. And what I used to do doesn't matter. It's what I'm going to do right now. I love that idea of the silver line. I actually saw that in action. So I'm a believer in that. Absolutely.
Let's do it. That's amazing. Let me just kind of really quickly, because I do have some other things I want to show you. I don't know if you could see this down there, but here, what we're showing right now is that Trump is calling for houses of warships are now considered essential services, and he's urging governors to let them open right now. And I was just wondering what your guys' thoughts we've seen cases occur in churches, and then the next story underneath that, I should have let you guys read that as well. Also speaks to, it says states are differing on their approaches to religious services during the pandemic. So we are reaching a point now where we're going to probably start seeing these cases that are going to be going through churches. We've seen that already, and just wondering what your guys' thoughts was on that.
So real quick,
when's the last time you seen the president and his family in church?
Well,
I got just a very simple question. When is the last time you've seen President Trump, Melania, Barron, Don Jr., and the rest of the crew in church, Episcopalian, Catholic, Baptist, whatever the church congregation denomination is? When is the last time you have seen the Trump family in church? And when you can answer that, I'll really care about his motivations for opening the church, other than pimping the evangelical community for votes, and they're going to vote for him anyway. And if they go to church in groups, they're going to die. So that's where I am with
mic drop.
Yeah, I was about to say, well,
that's
next
it.
topic.
There it is. Seen him in church.
No,
And that's an honest question.
No, that's true.
Family on a Sunday.
You always saw President Obama in church. You always saw every Sunday. You always saw
Obama got in trouble.
Yes,
because his pastor of the church where he was a member said some things that people didn't quite like. You remember that?
Oh,
That's
you
right.
remember.
He was a member in good standing in a church in Chicago. He kept going to church. His family went to church. His wife went to church. His daughters went to church. His mother-in-law went to church. When is the last time you've seen any member of the Trump family in church, singularly or as a family unit?
Yeah.
So
Go ahead.
that's a mic drop. But even before we get to even the mic drop, before all of this happened, we're having reports, and we have data, and we have a curve, and we have numbers that show when people, matter of fact, I can remember somewhere very close to here that they were having a problem because every time that they would try to have church, people would get sick, and they were mandated to stop. The virus has not changed. The more people congregate, the closer they get together, the more the virus doesn't spread, and the virus doesn't care why you're getting together. You could be getting together to pray. You could be getting together to eat. You could hug your grandmother after hugging everybody it is that you know, and all of you could become infected with the virus. Nothing about this virus has changed. So we need to make evidence-based and data-based decisions on how we will proceed carefully before we attempt to open anything up. The data, just like it allowed us to come out and the R0 and everything went down because we stayed away from each other, the moment we start getting back together, you see the spikes. We have the numbers. So again, common sense. If the last time I talked to MarkAlain, I got sick, we wouldn't have this show anymore.
No.
Really? That's all it takes? I get you sick? Dude, you never.
I wouldn't blame you. Listen.
Oh my goodness.
Keep talking about them.
I now know what I need to do.
If you only knew it was that simple.
Right. Holy crap. Wow, I thought it was so much more complicated. All right, let me do this. I got a couple more. I want you guys' commentary on a couple more things here. This is answering Dave's question. It's funny, I was going to answer it anyway. This week, the CDC came out with some important guidance. This is one of several, which is now they're saying the virus does not spread easily from contaminated surfaces. So that's a big deal because people were making a big deal about their packages and their groceries, and people would ask me what I would do, and I was like, I don't know, I don't really do anything. I just bring everything in. I take everything out, I put it in the fridge, I wash my hands when I'm done. And people always say, well, as an infectious disease doctor, I'm like, no, I don't really see it being a thing. And so it's nice to see that the CDC actually came out with some commentary that reflects that as well.
But Gralen, can I before Gralen we get the real of it, let me be very clear. This is not anything different than we had been saying. The fact that we need to wash our hands is the same as any other time. We've been begging you and begging each other to wash our hands because it's been proven to make people sick. and as a vector to make people sick. This virus is no different. They're not saying that you cannot become infected by staying away from each other and not washing your hands and not disinfecting and cleaning your surfaces. We need to be cleaner and more conscientious about washing our hands than ever, because the moment we get lax, again, the data is going to show. We start bro hugging and shaking hands again and doing all that stuff again. You're going to see the numbers from contaminated. There'll be another report that comes out. The CDC has found, based on the data, that touching an X amount of touching or touching of contaminated surfaces can cause infection with the virus. So again, we want to stay overly conscientious. The more you talk and you spit on a surface and you touch your hand and you don't wash your hands and clean it up and you go immediately to someone and they put it on their phone, the more likely it can get into your respiratory, the receptors in your eyes, your nose, your mouth, your lungs. I want people to not. You don't have to be, and that's what they didn't want. They didn't want people to go overboard, but I want people to still be as conscientious as we've ever been. This statement is just what we've been saying. It's a respiratory virus. It's the respiratory droplets that are landing on the surfaces. So you're more likely to catch it in larger doses from breathing it in. We don't know what the viral dose exactly is to make you sick, but you have a higher likelihood of breathing in from someone else's air or whatever virus might be in the air than on a surface. Where's the common sense curve?
Gentlemen, would you all agree that out of all the things we admonish folks to do and have continued to do, that hand washing would probably be at the top of the list? I know we need to wear masks, we need to continue the social distancing, but I don't know. I'm just trying to think if there's one thing that is very hard for you not to do, it's wash your hands. You need to wash your hands anyway. Please wash your hands. But see, I was washing my hands before it became hip. You know what I'm saying? Because that's just the way I was raised, man. You wash your hands before you go in the refrigerator. You wash your hands after you come out the bathroom. When you've been outside, you wash your hands. It's just a natural part of the way that you live. But nowadays, we're putting so much emphasis on it, as well as the social distancing, as well as masking up, as well as self-isolation and staying home and those things. I don't want to rank them, but I would figure if the one thing that people could do that would make it better for everybody, would it be the mask? It would be the mask.
Mask.
It would be mask.
Overwhelmingly.
Yeah, overwhelmingly.
And I'll tell you why, because that goes to the next story that I want to show you guys. So that's a perfect segue that you've given me. Of
course, it's a perfect segue from Gralen. Are you kidding?
Of course.
What I do.
You gave me the perfect segue. So I will. I'm still trying to.
Please take advantage of it.
Yeah. Well, and it's this right here. Look at this. It says here the CDC estimates that 35% of coronavirus patients are asymptomatic.
Sure.
35% are asymptomatic. So that is incredible, and this is what we've been saying for a very, very a long time. And let me while I have your guys' attention, let me show you the next big story that came out this week, which was that we now recognize this study was a very important study, and it shows that not only are the SARS-CoV-2 virus, it's airborne within small speech droplets. So just from me talking, and it can be airborne for up to 8 to 14 minutes and in the air. And so this is why this is so important, and this is why wearing masks, because people are asymptomatic, they don't know that they're sick. They could be talking and just spelling or spewing out the droplets out of their mouth. It could be just sitting in the air for 8 to 14 minutes. And if you don't have a mask that captures it here, it could just spread. And that's what we're seeing. And this is why we've seen transmission around the world like this.
So I hope that you have the video queued up at some point, because I did a story. I've been talking about this for a while. This actually was referred to in a New England Journal of Medicine article. What happens when we speak, the respiratory droplets have different sizes. There's large ones, medium ones, and small ones. Some of the particles that come out of our mouth are so small that they dehydrate almost immediately, but they can't contain enough mass and genetic material that the virus, it's not an aerosolized virus, but they hang out airborne with just enough mass and genetic material to hang out for 16 to 18 minutes. Now, Doc, we can talk about some of the viruses like the measles that are aerosolized viruses. That's a different. This is a respiratory droplet vector. And it's a respiratory droplet vector that has vectors, particles so small that they can hang out in the air that long, but it doesn't mean that they're aerosolized. What happens is they're airborne for that long and that light. So they can hang around, as opposed to the measles.
I have it. Hang on a second. So you guys ready? So watch this, Gralen. This is really, really, you have to watch very carefully. I'll narrate it, but watch right here. This is a guy speaking without a mask. It's in a dark room, but watch him speaking.
Stay healthy.
You see his mouth spittle right here.
Stay healthy.
Right there.
Great. Less loud.
Less loud.
Stay healthy.
Good.
Now with the mask.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
What do you guys think about that?
That's cloth, Gralen. That's just cloth.
That's the idea that there was nothing. I think we talked about that earlier. When something beats nothing, everything gets caught if you've got the mask on. But I did have a question for exercising. When that droplet was to stay in the air for that new 12 to 14 minute range, is that the same outdoors, or is that the same? How does, if I'm walking,
so that's a good question.
The path to somebody, do I need to make a bigger berth even if I
would?
Yeah, I mean, one, I do, but it's a good question. One is that sunlight kills the virus.
Okay.
Two, there's a dilution of there's a dilution of just it being in the air. This is mostly indoors. What we were talking about. So, like, I'd be very cautious about walking into an elevator. I would be cautious walking into a room where other people weren't wearing masks and stuff like that. I mean, this is the level of consciousness that we need to be thinking about. I think I run with a mask on. I think that's the right thing to do. I just wear it somewhat loosely. I kind of wear it like this. And then when I go by somebody, I'll do this. But if there's no one around me, and I tend to...
Which, by the way, drives me nuts. Folks, if you're supposed to wear the mask, everywhere air can go in or come out is where you wear the mask. This is not, you're still breathing air out, but that's a moot point. The point I wanted to make was that that Doc brought up a good term, dilution. A lot of people were asking about swimming. There does have to be a certain mass. We're just not sure what the dose is that you have to inhale or has to get to your respiratory tract in order for you to get sick. So if people were asking about swimming and all this other stuff, typically the virus is diluted in the water if no one is around. Where you get in trouble at the beach, where you get in trouble at the pools and saunas, is that you're not 6 feet away. It's the congregating that's the problem. I'm not saying, and which is why we say it's called a slipstream, Gralen. I don't know if I mentioned it on your stream.
Yeah, we talked about that from runners, from walking when you're back.
And bikers, exactly. Yes. So the social distancing is absolutely important. The safest thing, if you can tolerate it, and if you have a respiratory condition like COPD, a history of asthma, then you want to talk to your provider about whether or not it's safe for you to actually wear a mask outside. Ideally, you should, or how to actually go about it, but you definitely want to talk to your providers. And I have to go to the way back when we started talking. Whatever you had before COVID, you still have. If you were taking your pills for high blood pressure, it didn't just go away. You still need to take your pills. You still need to talk to your doctor. There are telemedicine things at Access Health. We have telemedicine now where you can actually still see your doctor. You haven't changed. Just like COVID hadn't changed, neither have you. It's just more serious for you to take care of yourself.
Right. Because nowadays with the high blood pressure, respiratory illness combined with COVID, it hadn't gone anywhere, but now it could be more dangerous for you if you stop taking care of the things that were bothering you in the beginning because of COVID, right?
Exactly
right.
Yeah.
Gralen Banks, we got to start wrapping up. Gralen Banks, radio personality, 1230 AM WBOK. Any last words? Anything that you want to leave us with? Weekend thoughts? COVID.
Thank you guys so much for having me. You know how I feel about the both of you, DeWitch. You guys are one of the highlights of the neutral ground. You are loved around the planet because we've got listeners that circle the globe, and everybody talks about two things. Number one, your honesty. You understand? And in nowadays, you've heard me say it before, in a world that now celebrates deception and lies, telling the truth becomes a revolutionary act. And you guys are revolutionaries. You do not mind your own Dr. Fauci. You speak truth to power, and it doesn't matter whether you like it or not. What only matters is that you continue on the path that you were set to before you got here. I got a friend of mine, Brother Walter Umrani, who always, he referred to me as a fixed star. And in the Muslim religion, they talk about a fixed star. And I think both of you guys are that. What that means is that when you got here, you were already set to do what you do. You could no more not do what it is that you do than you could flap your arms and fly. You're a fixed star. You knew that there was going to be a time, or he knew that there was going to be a time when you two would be needed to do what you were sent here to do. I'm a pleasure to be, it gives me such a thrill, such a pleasure, and I'm so humbled to be a part of this because you guys make me look good, and I hope that I'm telling you, listen, you guys make me look good because I'm living vicariously from an epidemiologist and a public health expert on the show where we talk crap like 90 going west. You know we do. We laugh, we talk about huckabucks in restaurants, and then I got these two brilliant scientists that come in, speak to our folks like they needed to be spoke to. And that's what I'm so blessed and humbled to be a part of. So, gentlemen, thank you. Thank you for having me on your show. I look forward to having you back on the neutral ground next week and for a whole bunch of weeks, even after that, because I just don't think if we get through COVID, by the time that's over, we're going to need y'all to talk about the next novel.
It'll be COVID-22. So.
Yeah.
It'll be COVID-22. We'll be talking about something else, but by that time, we'll have established such a rock-solid reputation that they'll come to us first.
Say, Gralen, you starting to see I'm wearing up. I've got that community medicine coming out. You heard him say COVID, huh? He didn't say COVID. He said COVID. He said COVID. He said, look, COVID-22. Yeah, he's starting to get it.
COVID, you heard me? That's what it happened, baby. That's what between hanging out on the front porch and hanging out with you, Doc, I'm not surprised at all. Not one bit. Gentlemen, thank y'all. Though I mean that you're doing the yeoman's job. All the work that you're doing is so appreciated. I know you're tired and I know it's frustrated, but you can't stop.
Thank you.
Appreciate it, Gralen.
Thank you.
All right, fellas.
Thank you. Hey, Gralen, stay home. Stay home.
I'm at the house now.
Stay home.
And I'm drinking water.
Wear a mask, everybody. Have a nice weekend. Everybody, peace out, everybody.
Wash your hands.
Wash your hands.
Take care, y'all.
Peace out.
Stay at your house.